Good day, Facebook family and friends, and welcome, welcome, welcome once again to another video of inspiration, of hope, love, support, and encouragement from Matters of the Heart. As you can see, there's a beautiful young lady on screen, and she's joining us today here on Matters of the Heart. She is Dr. Nicole Lewis, and I'm going to read a short bio about her in a minute. But first of all, I just want to welcome you, Dr. Nicole Roberts, Dr. Roberts, to Matters of the Heart. So happy to have you.
Thank you. Thank you so much.
Absolutely. And so Dr. Nicole Roberts trained in obstetrics and gynecology at Christiana Hospital in Delaware before joining the University of South Florida as an assistant professor and specialist in that field. She is a board-certified fellow of the American College of Obstetricians and Gynecologists and a certified practitioner of the Menopause Society. In 2021, she returned to Antigua, where she is currently a consultant in obstetrics and gynecology at Celesta Bird Medical Center and has a private office at Rovia Medical. Is that okay? So, yes, beautiful. Thank you so much again for coming on with us today, Dr. Roberts. And as you know, the title or the topic of today's discussion is navigating perimenopause and menopause, and this is going to be part 2. All right.
Wonderful. Thank you for having me.
Absolutely. This is going to be part 2. And so, Dr. Roberts, in the last video I did just a couple of weeks ago, I just touched on some of the things that I researched about and some of the things that I experienced, right? And so I just wanted to have a medical person join me just to give us an insight into the medical world when it comes to perimenopause and menopause. And so I'm going to give you a lot of opportunities to speak because I really want to learn. And I know my viewers are also wanting to learn some more about this. So the first question for you, could you just tell us what these are, perimenopause? You know, when I was growing up, I never heard much about, well, I really didn't hear anything about perimenopause for some reason. The only thing I heard about was menopause, right? But tell us a little bit more. Well, tell us, what is perimenopause?
So menopause is the time point at which you have now stopped having periods in its entirety. Usually because your ovaries aren't functioning the way they were before, typically around the age of 50, 51. So it's really a very medical term. It's diagnosed after you've gone 12 months without a period. So everything leading up to that, where you have symptoms of menopause, but you're still having periods off and on, that's perimenopause.
Right.
That's a period of time that usually starts somewhere in your mid to late 40s, although it can start earlier than that, and continues until you stop having periods and you're formally past the menopause. And then once you have stopped having periods, it's then called postmenopause, and that's from the end of your reproductive life until the end of your life.
Oh, okay. The end of your reproductive life until the end of your life.
So basically menopause for the rest of your life. You are postmenopausal and proud.
Oh boy. Okay, so postmenopausal. Postmenopausal, I need to ask this question. When do people, okay, so people say, okay, I'm going through menopause. Do you ever get through? You said postmenopausal, so I'm imagining that you do. But I've heard stories of people who, and I've read about it, of people who have experienced these symptoms of menopause until they're 70. So I want to know, and I hope the answer is favorable. I want to know if people you go through, if you ever pass through.
So when people say they're going through menopause, what they really mean is they're going through these 3 phases.
Or the phase.
So menopause is a moment in time when you hit that point where your periods have stopped. That's technically all menopause is. So when people are talking about going through menopause, they're usually talking about that perimenopausal period before where they may have symptoms and their periods are becoming irregular. They're also talking about the initial postmenopausal period where sometimes symptoms will linger. And it varies so much. You're going to hear this a lot today, but it varies so much from person to person. So there are some people who have almost no hot flashes or very few. And there's some people who have hot flashes from years before the menopause until a few years afterward. And it very much varies from person to person.
So it's very unlikely then that somebody would. Okay, before I ask that question, so about what age group? Because I know it varies, like you said. What
Mhm.
age group a person would, well, you said menopause starts at about 51. That's an average
So,
age, right?
so menopause, i.e. the time when you stop having periods,
Mhm.
on average in the Western Hemisphere is about 51.
51, right?
And so people can have menopausal symptoms or be in perimenopause sometime in that decade before, and they can have menopausal symptoms that continue years afterward as well during the postmenopausal period as well. It's
Well, that,
very variable.
uh-huh. So do you think that most people, or what are the statistics on that? Like, well, maybe you don't have the statistics, but what do you think? Do you think most people pass? Okay, I still say pass through. I'm thinking pass through, meaning having gotten to the place where you've stopped having the period, for 12 consecutive months, and then you're just free of all the symptoms. Do people really experience that?
Some of the changes that happen don't go away. But when you're talking about things like hot flashes and that kind of thing, most people find they start to wane within the years that follow. So
Okay.
it's not often that I have a 70-year-old come into my office devastated because she's continuing to have severe hot flashes. It doesn't mean they never happen, but a lot of the times they become mild enough that they're not as big of an issue as they were during the initial transition period.
That makes sense.
Mhm.
Okay. And you mentioned that some things, I really want to know about this, right?
Yeah.
You mentioned that some things um will remain. I think
Yeah, so remember the symptoms of menopause are all the result of decreasing hormone levels in your body, decreasing ovarian function.
Mhm,
And so some of those things, like the hot flashes, and some of the mood effects and that kind of thing will get better as you get further into your postmenopausal life.
mhm,
Some of them, like the vaginal dryness, are a natural response to having less estrogen, and that doesn't really change. So while a lot of people will find my hot flashes were really bad when I was in my 50s and I got into my 60s, and like it happens every now and then, but it's not as bad. The vaginal dryness typically is a persistent symptom. And
uh,
then we're talking about ways to manage that for
yeah,
the rest of your sexual life.
right. And then what other symptoms persist?
It
Can you
varies from person to person.
uh-huh, okay, okay.
That part's a little bit harder.
Right.
Because it's also because some of the other less studied symptoms are also things that we see happening just as we get older.
Right.
So a lot of people, as they're entering menopause, will notice kind of brain fog or forgetfulness,
Mhm.
which is a really hard thing to pin down because it's so subjective.
It's so true.
But,
So true.
but
Yeah,
it's also, how many, 80-year-olds have the memory they had when they were 30. So
right.
it kind of becomes challenging to know how much of this is menopause, how much of this is aging. For
Right.
example.
Clearly, clearly, clearly. Alrighty, so let's move on to the other question that I have in mind. Um, what are some of the signs though of the perimenopause? Now, I remember when I was 40, and I said that in my previous video. I remember just turning 40, as a matter of fact, probably 39, I don't know. I woke up in the middle of the night, this first time it happened, and I was just sweat,
Mhm.
drenched, right? And at the time I didn't understand what was happening, until I probably read up and thought to myself, hey, maybe it's that whole, peri.
Mhm.
So what are some of the symptoms that ladies who are in that age group, 40 to 50, um, can expect?
So, and I know I said I'll say this over and over again, it very much varies from person to person, but some common signs, some things that people will come into my office and say that I'll say this might just be because you're in your 40s. So yes, hot flashes.
Yes.
Although if you're in your early 40s, I'm going to be making sure that your thyroid function is normal. We're going to be talking about sleep hygiene, like how warm is your room when you're going to bed, etc.
Mhm.
So we're going to be thinking about those things even before I think, is this just menopause coming? Probably the most obvious sign is going to be your periods becoming irregular. So starting to skip periods, starting to notice that periods are late, starting to notice that periods are getting lighter or changing.
Mhm.
Typically, if your periods are less frequent or if they're lighter, then I'm more likely to think this is probably just a premenopausal or perimenopausal change. If they're getting heavier, longer, more frequent, then I'm going to be more concerned there may be another cause and I'm going to be looking for other reasons for it. Some people will actually start to notice some degree of vaginal dryness or sexual discomfort, changes in their libido, changes in their sexual enjoyment and interest. And so those will also be things that I'll consider, again, needing to be investigated to rule out other potential causes, but keeping in mind that these are common things that we'll see in your 40s as menopause approaches.
Ah, wonderful. And so you mentioned that um there are certain conditions that may mimic menopause. And you mentioned thyroid issues. Um, anything else that we could think of that could
So it
mimic?
depends on the symptoms that you have.
Mm-hmm.
Thyroid disease definitely is an easy one. That can cause hot flashes, that can cause the night sweats, that can cause the difficulty with losing weight, depending on what's wrong with your thyroid. So changes in your body habitus and your body shape, which can be really distressing for women. We do see a higher rate of certain mental health conditions in the late 40s, 50s, so around the time of menopause. So we'll see more depression, anxiety, panic attacks. And some of the question is some of that may have some correlation with hot flashes. Some of that may have some correlation with the fact that maybe it's going to be less so for millennials, but especially historically, your late 40s, your early 50s is also a time of major change for a lot of people.
Mm-hmm.
Often major changes in your career. That's a time when a lot of people get promoted to managerial positions and they're taking a lot more responsibility. That may be a time when you're thinking about home ownership or when your children are going off to college and you're now left at home alone with your partner for the first
Absolutely.
time in 20 years. You know? So there are a lot of other life experiences that are happening that can cause mood changes that we will sometimes dismiss as being menopause or hormones, but that are related to genuine changes in your life circumstances that need to be addressed.
I think that was a great balance.
Yeah.
That was such a great balance and just a timely word of wisdom right there, right? Yes. Because just recently, interestingly too, I was talking to my family and particularly my younger daughter, who is going to my last daughter, who is going to be going to college next year. And so
Empty nest.
I saw some she showed me her senior pictures, and then I saw one of the neighbors moving their kid to college, and I became so emotional, and it lasted for a while. So interestingly, it is interesting that you would say that, because it's so many things that are intertwined at this time of
Yeah.
life. And that is such a powerful word of wisdom that you just gave us there. All
It's a
right.
big part of the conversation I have to have with patients when they come in worried is, yes, menopause is happening. It is a natural part of what's supposed to happen to your body. So
Mhm.
let's try to parse out the things that are, causing you significant issues with quality of life, but let's not forget that your life is still continuing and there's so much else that can contribute to why you're in this moment that's not going to be fixed by a medication all the time.
Right, right. And so sometimes we actually blame menopause. It's possible that we blame menopause for things that are not because of menopause, right?
I think that's true of all things, right? We blame our periods for a lot of things that are just people doing things that make us mad. So I think sometimes it's easier to say it's just the hormones than to really delve into what else is going on.
Deal with the issue, right?
And I think that sometimes it's a combination. Even if we're addressing one, we really have to be thinking about the context that we're living in and how that's affecting how we feel.
Girl, I tell you, that's something. I think that is a part of the conversation that I needed to hear, to be a part of. All right. So on the issue of trying to cope now and navigating this time of life, what are some of the things women can do to alleviate or manage symptoms, or just, manage the time of life in general? And of course, thrive and be joyful and enjoy life and
For a lot of women, this is actually the best time in their lives.
Mm,
So we need to make it as wonderful as possible.
yeah.
I think honestly, the first thing I think is what you're doing right now. I think awareness is a big part of it. For a lot of people, a great deal of the distress that is experienced around menopause has to do with the unexpectedness of the changes that happen. And if they know this is going to come or this may come, and if it comes, it's okay, there's nothing wrong with me.
Mm,
I can see the difference in the patients who knew it was coming and were okay with it from before.
mhm.
But then really management very much focuses on what symptoms you're having and how it's affecting you. So for people who have a lot of hot flashes, often their first response is going to be fans, cool drinks, air conditioning, identifying triggers. Things like alcohol, spicy food, hot food can all be triggers for hot flashes. Um, it may be something as simple as air conditioning in the bedroom and making sure your room is cooler when you're going to sleep, making sure that you're wearing layers so you can shed more quickly if you're realizing I'm kind of feeling hot. I was actually, they must have known I was coming here because YouTube started showing me lots of videos about menopause. And
Really?
there was an interview that Halle Berry did where she was talking about a special cooling mattress that she bought that changed her life.
Oh,
You
wow.
know, things like that that can target it. When we're talking about vaginal dryness or difficulty with sex, specifically for vaginal dryness, I'm often talking about things like over-the-counter lubricants, knowing what works with you and what works for you. But I'm also talking about recognizing that um, even in your 30s compared to your 20s and your 40s compared to your 30s, um, getting aroused or being prepared for sex may take longer and may require more intention. You know, when you have kids that are running around and requiring things of you and that kind of thing, simple things like taking time to date or to interact with your partner in intimate, even non-sexual ways can help with creating the desire or continuing the desire that you need to have a healthy, intimate relationship with your partner.
Mhm.
When we're talking about just general health around menopause, I'm always encouraging you to be paying attention to your activity. This is a time in your life when you're going to see changes in your body, some of which are going to be very distressing. When it's going to be harder to keep your weight the way you want it and to keep the shape the way that you want it and things like that. So focusing on ensuring that you're getting good balanced exercise, cardiovascularly, strength training, resistance training. You're thinking about things that are going to keep your body strong and healthy for a long time. This is a time where if you haven't established those habits, do it now because it gets harder the older you get.
Yeah.
I talk to patients about diet. Not that there's a specific diet for menopause, but that really, again, being focused on putting good things into your body so you can get the best out of it becomes incredibly important. Your body is going to be less forgiving of you now than it was when you were, in your teen years.
Mhm.
Um, some people will find that things like products that have soy can be really helpful for some of their menopausal symptoms. The data are plus minus, but if it works for you, fantastic.
Yeah.
So a lot of it is focusing on good general health, making sure that you're up to date on your checkups and you know what's going on with your body. You're getting your diabetes testing and your blood pressure checked and those kinds of things. And then really focusing on, okay, these things are happening to my body, even if it's a normal, okay thing. If it's causing me some distress, what kinds of things can I do to mitigate it? And when those things don't work, that's what we're here for.
Right. Right. And have you ever encountered in your practice over the years people who go through menopause whose symptoms are such so severe that it impacts or has a negative impact on their quality of life?
Oh
And
yeah,
mhm, like, could you
absolutely.
you tell me more? Tell us more.
Well, so that's generally when people get to me.
Mhm. Ah.
We'll talk during your checkups if you're coming for your checkups about the symptoms you're experiencing and how to manage them. But I will often see patients in my practice who come in specifically because their menopausal symptoms are significantly impacting their quality of life.
Mhm.
Their hot flashes are not getting better despite the things that they're trying.
Mhm.
Their vaginal dryness is severe enough that they're avoiding intimacy, or that they're afraid to be intimate. That they're noticing the kind of memory lapses and mood fog and mood swings and those kind of things at a point where they feel like I'm not coping well.
Mhm.
Um, and in those situations, we'll talk about obviously supportive things that they can do at home, but if they've been trying those things and they haven't worked, then we'll talk about pros and cons of medication.
Pros and cons.
And in situations where, for example, there's a significant mood component, we may talk about, even as we're doing our thing,
Mhm.
therapy or psychiatry, depending on what's needed to help with dealing with some of those changes that happen. So it's not always as simple as just give me the drug and everything's going to be great.
Yeah, exactly. Um, yeah, that's something to think about. Alrighty. So let me see here. I know that there are tests, if a person like they're 42, 43, and they're experiencing symptoms that they're concerned about, are there tests that they can take to determine if their hormone levels have, the levels of their hormones? And then would that indicate, do you have a test to tell somebody, hey, you're in perimenopause, or you're in, not in menopause, because we know that menopause is pretty standard after 12 months of not having a period, then but then if somebody is having these brain fogs and these strange things that are beginning to happen, can they test to see, hey, you know, my doctor
Um,
told me, yeah, based on what you're saying, yeah, but you know,
so yes and no.
yes and no.
We can definitely do tests that will assess the levels of your hormones. The
Mm-hmm.
challenge is there is no standardized hormonal definition of perimenopause.
Right.
So when you are in that last decade or so leading up to the menopause, as your hormone levels are dropping, they do not drop in a linear fashion. So it's not that it does this.
Right.
They
Right.
actually do this.
Oh, that makes sense. That
So
makes
if I were to do a random blood
sense.
sample, I
Yeah.
might catch you here, or I might
Right.
catch you up
Right.
here.
Right. Got
And
you.
if I catch you here, I might say, okay, your levels look like menopause, but you're still having periods, so you're in perimenopause. But that's all it tells me. If I
Right.
catch you up here, it
Then
gives
you
me no
don't know.
information at all.
Exactly. Yeah.
So usually when patients come with these concerns and I do lab tests, I'm really trying to rule out other reasons.
Yeah. Yeah.
So I'm trying to make sure it's not your thyroid, it's not your diabetes, it's not your kidney or whatever.
Mm-hmm.
Um, and once those things are ruled out and I can say you seem otherwise healthy
Yes.
and these symptoms are consistent with perimenopause or menopause, then I can say then this is most likely what the cause is. And here are some things we can try to see if we can make the symptoms better.
Right.
So it's not, there's not a good test to
Right.
be able to diagnose perimenopause.
Mm-hmm.
Menopause is actually easier to diagnose. One, because of the clinical definition, but what about those patients who, for whatever medical reason, don't get periods?
Wow.
There are
You know,
some
I never
people who
thought about
get
that.
periods very infrequently, or who'll say, I get a period a year, maybe if they're not on medications, but they're not in menopause at 20. How do we determine that they're there? There are tests that we can do around the time when we expect that you'd be in menopause to reconfirm what we think is going on.
Right.
But you'll find that in terms of tests that can practically help us manage you, there aren't a whole lot of blood tests that would allow us to be able to give you a definitive answer. You are in perimenopause, and that is why this is happening.
Mm-hmm.
So it ends up being a little bit of a diagnosis of exclusion in that respect.
Mm-hmm. Is there a situation where, because you said that hormones just don't just plummet, right? Okay, so that is what I was gonna ask you, because I felt at one time my hormones just did this.
So,
I was
so
misguided.
funny.
Mhm.
Well, and that's part of why doing the blood tests
Yeah.
doesn't necessarily help us,
Mhm.
because was it that you were misguided? That feeling is real.
Right. Well, hey, I know. Because
Right?
I could tell when I started to feel different. And I've been reading
Yeah.
about it. I'm always curious about things that have to do with my body, you know? So I was always reading about things and asking questions, right? So yeah, I
So
felt
no,
like
so I wouldn't say you're misguided.
right,
The way that you feel doesn't always correlate with the number on the lab test.
right.
And the way that you feel is really what matters more.
Yes.
But yeah, it's that your ovaries start working less efficiently and less consistently. And so you'll get some highs and some lows, and it's that fluctuation and gradual overall decrease that leads toward menopause. The exception being surgical menopause. If I
Right,
go in today and I
right.
take out your ovaries today, your hormones will do this and you will feel it.
Wow. So, Dr. Roberts, is there anything that, like over the counter things? Because our time is the time is running out. Um, over the counter things that you could recommend, like for example, the last time I was sharing on this topic, I had told my audience that I used to use, because I really don't use this a lot anymore. It's called Evening Primrose. Is
Mhm.
that scientifically, have you come across that in your research? And do you think,
Oh.
yeah,
A lot of people will use things like evening primrose oil, black cohosh, and um, other
white things
plant-based
stuff? Yeah.
estrogen type substitutes
Yeah.
like the soy and that kind of thing. There's a bit of equipoise in the literature. So there are some people who find it really helpful and some people who find it doesn't do anything.
Mhm.
Uh, what I typically will tell patients is any supplement that you're going to try, make sure that your doctor is aware of what you're
Okay.
a lot of the times we don't have good data to be able to guide you as to whether it's the best thing or not.
Mhm.
But we really want to make sure that if it's something that could interact with a treatment that we're going to be
Right.
trying, we just need to be aware of it.
Mhm.
That's usually the biggest thing.
Yeah. So what treatments now? Because I have listened to so many people. This one lady said she got some sort of, I don't remember what she got, but she got a hormone replacement, I think.
Mhm.
Yeah. What types of treatments are available for people who feel that they need it?
So if menopause and menopausal symptoms are caused by a drop in your hormones,
Mhm.
then kind of the obvious
Right.
thing is to give them back.
Yeah.
So you'll see hormone replacement in multiple formulations. The things that are FDA approved are going to be various pills, creams, sprays,
Yes.
pessaries or suppositories, that kind of thing, intravaginal creams, etc.
Mhm.
There are compounding pharmacies that are not going to be kind of FDA monitored, but that can compound things like pellets. You'll have probably heard of pellet therapy and that kind of thing. So a little bit less regulated, but a lot of people have benefit from them especially once you're working with a physician who's really well trained in managing and monitoring those things, and you're well counseled about pros and cons. But hormone replacement, while it is wonderful for treatment, comes with its own risks that
Yeah.
are going to be very much dependent on your own medical history, your own family history. For a well-selected patient, the risks are relatively low,
Okay.
but it's not for everybody all the time.
I agree. I
There
agree.
are there are non-hormonal options for people who either prefer to avoid those risks or for people who cannot take those medications because of their own health history, that are typically going to be specifically targeted to particular issues. So
Right.
there are some antidepressants that you can use for hot flashes. There are some pain medications that also work for hot flashes.
Oh,
Um, there are vaginal moisturizers and lubricants and other things that can be used for the vaginal dryness. So the non-hormonal options really are going to be guided by the symptoms that you're trying to address, your own medical history, and a discussion with your doctor about pros and cons of whatever treatment option you choose.
right, right, right. And so at this age and stage of life, Dr. Roberts, what um what would you advise that women begin to do? And I think I'm thinking in my mind, I'm thinking about like just doctor visits. I know there's some people who generally are afraid to go to the doctor, who
Mhm.
generally are. just skeptical about medicine in general, so what advice would you give to women, like myself at this time, especially? I mean, I think people should always be visiting their doctors and keeping up with their annuals and so on. But at this stage of life, I just want you to leave a parting word to our viewers.
So the truth is, when you get into your 40s and 50s, your risk of chronic health illnesses and major health illnesses is actually higher than it ever was in your 20s or 30s. So your physician care is really important. But I think the first thing I would say is to find someone you're comfortable with. Because you
Right.
need to be able to talk about these things, sometimes these uncomfortable things, to be able to get them addressed. In terms of general health, from about the age of 40, we should be starting your mammograms. From about 45, 50, you should be starting your colonoscopies. You and your doctor should be having conversations about the symptoms you're experiencing and the small changes you can make while they're still relatively mild to help you live your best life. Outside of the doctor's office, what you eat and how you treat your body are going to be really important. Again, your body is not going to forgive you the way that it did when you were 15,
Absolutely.
So making sure that your diet is balanced. That doesn't mean you can't have dessert, but that means thinking about the other food groups as well. Making sure you're getting your exercise, not just cardiovascular, but also weightlifting, weight bearing. We're thinking about your bone health now, trying to make sure bones stay nice and strong so that
You
you can
say,
continue
I'm
to run
sorry,
around after your.
you said weight bearing?
Yes. So weight bearing exercises are exercises that put more pressure on your bones and helps keep them strong. So it helps prevent osteoporosis. So some weightlifting exercises will do that. Running, the high impact of running will do that. An exercise that I love, but that is not good for weight bearing is swimming. Because of the weightlessness that you get in the water, it's great for
Right.
cardiovascular, it's great for preventing injury, but it's actually really bad. Not bad, but it's really not helpful
Oh,
for your
right,
bone.
right.
So it's a combination of things that you want to be doing now to try to help keep yourself strong, flexible, and able to do the activities that bring you joy with the people that you love.
Absolutely. And Dr. Roberts, it was such a pleasure having you. I learned so much because there's certain things I did not consider at all. And you brought so many balances to my thinking. And so I just want to thank you so much for joining us, for just agreeing and just being so humble with it. Joining us here on Matters of the Heart. Facebook family and friends, I hope that you are blessed as I have been. Thank you once again, Dr. Roberts, and Facebook family and friends. Do have a blessed and productive week. God bless you. Bye-bye.
Thank you for having me.
Let me see here.